Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. Today's guest is Jose Rocha. He's Director of Corporate Business Office at First Choice Neurology. Welcome, Jose.
Nice to be here.
Yeah, so tell us a little bit about yourself and First Choice Neurology.
Well, First Choice Neurology is a private practice in Florida. We're Florida's largest neurology private practice. We have about 100 providers, about 59 offices, all the way from the Georgia line all the way to the Florida Keys.
Wow.
We see roughly about 1,600 patients a day, and we service about 42 different hospitals.
Wow.
Busy, but fun.
I'll say so. Well, we're here at the eClinicalWorks Enterprise Summit, and you've implemented their version 12. Talk to us about what some of the highlights have been of implementing version 12.
Okay, so version 12, it's one of the things that if you go through, you've been a client of eClinicalWorks or any software company, Apple does coming out with better and best, but if you go 14 was just as probably good as 13 when it comes to to Apple. Well, when it comes to eClinicalWorks, you were waiting for that version that delivered. Version 12 is the version that delivers.
Wow.
Version 12 had brought some new tools. It brought some improvements, some interoperability. It made our providers went from surviving to thriving, which is very good, and it made it more likable for everybody, easier to use, easier to interact with patients and between providers. So a lot of good stuff with V12.
Yeah, but it's interesting, when we were talking before, you mentioned that your doctors kind of, it was a tool they had to use to, as part of their practice, but now they enjoy using some of the features. Talk about some of that.
Well, it went from okay, this is the tool that we have to go to use the note, This is the tool that we have to do for MIPS. This is the tool for claims. This is the tool
all the government regulations.
Yeah, but it went from this is just a tool to now they're not so frustrated. They can actually look into the system and say, what's this for? Well, how does this help? Because a lot of the things went to helping the provider have a better picture of the patient, a better understanding. And when you deal, like we do with a lot of Alzheimer's and dementia patients, having access to records is very important to us. I mean, the patients sometimes don't remember that they were in the ER last week or that they were at a clinic, or because they're snowbirds, that they're getting this treatment up in New York or they're getting this treatment up in Boston. So it doesn't, having information to those records is critical for us to have a complete picture of the patient. Being able to do that in graphs, being able to see lab work that was done, a month ago instead of repeating the lab work because we didn't order it. Maybe the PCP ordered or somebody else did, or maybe the patient was at an urgent care or an emergency. All these things now provide for more tools for the provider to be able to have a better picture of the patient.
Yeah, so I think you're talking about Prisma within ECW's product, right?
Yeah.
And it just searches across all organizations, not just your own EHR. Is that what you're using to access all this info?
Correct. We use Prisma a lot. Actually, it's become probably a very valuable tool. Besides all the nice things that V12 has, it has the floating toolbar, bigger windows, it has the shortcuts, the macros. Those are all great tools. But Prisma is really that tool which allows the doctor to Google. I want to see CBCs. Where are the CBCs that this patient had? When was the last MRI of the brain that the patient had? What did it look like? And even for us, it allows them to look for stuff that's even in our database, but this might be a patient that we're seeing from 10 years ago. So we can put all the brain MRIs kind of together and look at them, click on them and see them. So we can see the progression of the disease. So it's a very essential tool that has now part of our doctor's daily living, you know?
Yeah, well, it's interesting. I almost, hearing you talk about this evolution of the eClinicalWorks product is from one that allowed you to comply with regulations to now impacting patient care. Is that how you would describe it?
It definitely has impacted patient care. One of the things that I said is we service 42 hospitals. So that means if I want to see the records, I'm logging into 42 different EHRs. And hospital A puts all their documents in this window, hospital B. So you have to become a master of all these things. By having Prisma, it all comes into my system. So I know where in my system it is, and I know how I can, and I have a taskbar to look. I can Google it, for lack of a better word. I can search for all the brain MRIs. I can search for the lab work. I can search for the last time the patient was on this drug. And maybe, patient was on this drug with another provider, doesn't remember now where we were gonna put him on it, but then realize, oh, it didn't work for you, let's try a different alternative. So definitely Prisma is impacting patient care.
Yeah. Well, and it seems like the next step in this whole evolution is summarizing all that data, because now you're getting the records from everywhere. But how do you make it simple? You just talked about graphing all of the data. That's an interesting way. They also introduced a feature that's coming soon that will summarize the patient. What do you think about that?
Oh my God, I thought it was fabulous, and I literally can't wait to see it. I thought it was very nice that it does that summary and that you can see, because that's what the doctors want.
Yeah.
It's funny. We've gone from, the staff is printing all these medical records, or then to import it into the system so the doctor can have it. And sometimes the staff is not clinical. Right. They don't know that the doctor doesn't need this test or doesn't. Sure. They just know he was in the hospital. Let's print all this stuff and read. Now the doctor can actually get a summary of what he needs, what he likes. It'll be seeing a quick summary and say, okay, let me go more detail in this. So all of that is great tools that are going to save a lot of time. Prepping the patient, and I think giving the provider also a better view of the patient.
Yeah, absolutely. Jose, I appreciate you taking time to share these insights and perspectives, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, Jose.
Thank you.